Hi everyone, this is Dr. Navneeta Kapoor from Mind is in Charge, Not the Body. Well, it's all about health awareness about everything but in my way. And it's absolutely free for everyone. I'm on Facebook, on WhatsApp, on Telegram, even on Instagram, on TikTok. Well, you could find me on Google if you type in Mind is in Charge, Not the Body, and you'll see all the links. Well, today I wanted to ask you, how are you doing in bed? Well, we all know that our sexual health is as important as our mental and physical health. Now, there could be a number of reasons for these sexual issues. It could be that you ain't interested in sex. That could be for men and for women, and it's called loss of libido. Well, the main causes of loss of libido in men are it could be low testosterone levels, or it simply could be depression. It could be sleep disorders, or it could be stress and lack of exercise. Maybe they have a restless leg syndrome, or they suffer from a chronic illness. Maybe it's simply aging, or it could be low self-esteem. And it could be a lot of alcohol and even drug abuse. Now, the reason why women don't want sex, it could be that they're tired all the time and they've got fatigue, or maybe they are in pregnancy or they are breastfeeding. Maybe they have a poor body image. Maybe they have a history of physical and sexual abuse, and they don't feel comfortable in having sex anymore. Maybe they have relationship issues, or it could be that they're simply going through menopause. Anxiety and depression could also be a reason, and maybe they have a low self-esteem and they're not happy the way they look. Maybe they have stress or other sexual problems. Now, another reason in men could be that they ain't even getting an erection. Well, that's called erectile dysfunction. Now, there could be many reasons for that as well. It could be that the men have a heart disease, or they simply suffer from high blood pressure. It could be that they have had a previous surgery from cancer of the prostate, or it could be just simple drug abuse. It could be emotion and stress issues. It could be high cholesterol, or it could be a peripheral artery disease, or it could be simply an injury that they suffered in the pelvic area, or even smoking or vaping. Well, another frequent problem that we come across in men is that they are getting an erection, but they're coming too soon. Now, that is called premature ejaculation. Again, there can be a number of causes for that. It could be psychological factors, it could be biological factors, and abnormal hormone levels and brain chemicals may be inherited traits, or they could have simply interpersonal relationship issues. It could be anxiety and stress. Well, if you have any of these problems, not to worry. In case of men, go and show it to a urologist. In case of women, go and get yourself checked out by a gynecologist. Now, they are the only doctors that are trained in this sexual issues, and they can send you for some tests, find out the reason of your suffering, and support you with the appropriate treatment. Now, here is what you can do. Well, along with your doctor's medication, you could try some foods that will increase your libido, that is your condition or your intention of having sex. Well, try some oysters, maybe strawberries. How about trying some dark chocolate or pomegranate? Maybe watermelon or basil nuts can help. Well, there's so many foods that can help you increase your sex drive, like avocados or berries, especially blueberries. How about trying some walnuts or peaches can help? Even ginger, pumpkin seeds, and chia seeds. Well, foods that increase your semen volume could be tomatoes, dark chocolate, bananas, eggs, and even spinach can help. There are foods that are really, really good for better sex. They are saffron, and maybe try some pineapple. Well, there are foods that can increase your testosterone levels. How about trying some mushrooms or maybe some basil nuts? Maybe some kind of hot sauce or eggs, even pumpkin seeds and olive oil. They can all help in increasing your testosterone levels. So think about it. You don't have to suffer and don't have to suffer in silence. If there is a problem, don't be ashamed. Go to your doctor. He's the only person who can help you with a diagnosis and give you the appropriate treatment. And with all this effort along with that, you might just experience that magic in bed again. Think about it. Still, it's entirely up to you. Goodbye and good luck.